So today we are going to be talking about long-term positioning in sidelying. This is for patients with complicating conditions that are on a regular turning schedule, which means that the patient can be turned on both their right and their left sides. So to do this, there are four main goals. The first is immediate safety. This means we want to have a clear airway so that they can breathe efficiently, and then we also want to position them in a way that is close to either their call button or somehow that they can alert someone if they need something. The second is normal spinal alignment. That means we want to put a pillow under their head, align it with the rest of the body, and then we also want to have the bottom leg straight and the top one bent. So this will help us to have a normal spinal alignment. So our third goal is to prevent pressure ulcers. There are a couple high-risk areas for getting a pressure ulcer. And the last goal is to prevent edema or contractures. So our upper arm is at high risk because you're just laying there and all the blood flow or all the fluid in our body is just going to that hand. So to prevent that, we want to have the patient either hold a pillow or keep their arms slightly abducted and at or above the level of the heart. And this will prevent contractures and edema. All right, so the patient can either be slightly forward or slightly backward because we want to take the pressure off the humeral head and the femoral or greater trochanter. So do you have a preference on being forward or backwards? Backwards. Backwards? Okay, so I want you to bring your bottom hip out and your front hip and your shoulder out. And then I'm just gonna put this pillow behind them. Okay, go ahead and lean onto that. So now we took the pressure off the bottom, shoulder, and hip. All right, now I'm gonna put a pillow for their head. You can leave this flat or fold it in half depending on how much height they need. I'm going to, this leg is straight and this one's bent. Can you go ahead and lift up? We'll put this protects the medial condyles. And then I'm gonna put one between the ankles, so I could just put one like this, but because I also want to protect the bottom, I'm gonna fold this over like this. And so that is protecting her lateral malleolar and both her medial. And then to prevent edema of this hand, I'm gonna ask her to hold this pillow and both hands are gonna be up at heart level, at or above heart level to prevent edema or any contractures. So are you comfortable? Perfect. About long-term positioning for sitting. So this actually has the same four goals as we did for long-term in sidelying. So the first is immediate safety. We want to make sure she has a call button or is close to anything that she can get help if she needs it. Also, we want to make sure she is safe with her hips all the way back in the wheelchair or whatever chair she's in, because we don't want her to fall forward. We want her knees to be slightly above her hips. We want to make sure her arms are up either on the armrest or out of the way of the wheels, and then if need be, we want the lateral supports. So then the second goal is normal spinal alignment. So for that, we want to make sure that her hips, again, are all the way back. Her shoulders are right over her trunk and her hips. Again, her knees are slightly above her hips, and so we want her knees and hips to be at least at 90. All right, and also because we're just in a wheelchair, we want to make sure her back has enough support for her normal curvature. So I'm going to add this little towel right in the curve of her spine. Go ahead and lean back, and that helps her have a normal spinal curvature. Is that comfortable? Good. All right, so our third goal is to prevent pressure ulcers. To do this, again, we want to make sure she is all the way back and in the chair and that her weight is evenly distributed. We want to make sure her knees are higher than her hips because this takes some of the pressure off the thighs. We want to make sure she has an appropriate seat cushion. So if this isn't comfortable long term, she can think about getting another type of seat cushion. Not in this chair, but in other chairs, you might want a cushion between the knees to make sure that there are no pressure ulcers that will occur there. And for our fourth goal, to prevent edema and contractures, we want her arms to be slightly abducted and resting on the armrest. Her elbow should be slightly extended, her hands up and at heart level. Then for her calves, we want to make sure that either there is some sort of cushion behind it. If there isn't, we could add like a pillow or towel behind there. And then any other contact points, we would add a cushion too. And that would prevent edema and contractures.